Hi, I'm Bob. I'm a nurse practitioner student. I'm here today with my patient, Angelica. Um, she's coming to the clinic today with complaints of leg swelling. I washed my hands before sitting down and before doing my exam. Angelica is a 74-year-old female. She's retired. She used to be a school teacher. Um, so, in reading the note here from the nurse, you had this leg swelling start about 5 days ago. Is that correct?
Yes,
Okay. And is it one or both legs?
both legs.
All right. And during the last 5 days, the swelling has been all day. Like even when you sleep at night, you still have the swelling. Is that correct?
Correct.
Okay. And in terms of characteristic, it seems that the swelling, while being persistent, your skin is also a little tender to the touch.
Yeah.
Okay. You also reported to the nurse that it was a little bit more difficult when you walked. You felt like the swelling worsened at that time, and that you've tried elevating your legs, but that has not improved the swelling.
Not really, no.
Okay. You reported that the swelling just seems to stay in this area and doesn't radiate anywhere else.
Yeah.
And that about 5 days ago you went to a cookout, and during that cookout you ate a lot of food, probably food you shouldn't have eaten.
No.
And you also had a little bit more to drink than normal. Is that correct?
Yes.
Okay. All right. Now, you've had swelling like this in your legs before, but it's never been this severe?
No, not this bad.
Okay. All right. And anything else that you've done to help alleviate the swelling?
No.
Okay. All right. And your current medications, you're currently taking lisinopril 10 milligrams daily,
Yes.
metoprolol 25 milligrams twice daily,
Correct.
Lasix 20 milligrams PO daily,
Yeah.
and potassium chloride 10 milliequivalents daily.
Yes.
Okay. In terms of surgery, you had a 3-vessel cabbage about 12 years ago when you were 62,
Yes.
but no other surgeries?
No.
All right. Other medical history, so you had an MI at that time, correct? You have high blood pressure,
Yes, that's correct.
and no diabetes.
No diabetes.
Okay. Social history, you're retired.
Yes.
You live with your husband.
I do.
You've never used drugs.
No.
Or illicit drugs.
No.
You smoked a pack a day for 20 years, but you quit 30
Yes.
years ago. And again, you drink socially, usually 1 to 2 beverages,
Yeah.
but last weekend was about 5 or 6.
A little bit more.
Happy birthday. In terms of your family history, you're currently older than your parents were at the age of their death,
Yes.
but both parents were lifelong smokers. Your dad did have an MI and died at the age of 62.
Yes.
He also had high blood pressure. And your mom, she had a stroke and she died at the age of 72. No siblings.
No
One
siblings.
child.
Yep,
Okay.
just me.
All right. In terms of reviewing our your symptoms and such, any fevers, chills, body aches, or recent sick contacts?
No.
But you have had, you have noticed that you feel like you've been gaining weight over the last week or two?
Yes.
Okay. 5, 10, 15 pounds?
Probably like 5 or 10.
Okay.
Between 5 and 10.
Okay. Any dizziness, lightheadedness, or headaches?
No.
Okay. At night, are you having difficulty breathing when you lay flat?
Yeah, sometimes.
So, what has seemed to make that better? Like lying in the chair and sleeping at night, or propping up your head?
Propping up my head has seemed to help.
All right. Have you tried sleeping in the chair?
Yes.
And it helped too?
Yes.
Okay, good.
Kind of done it back and forth.
In terms of walking, you've had some shortness of breath with exertion. And what about at rest? Are you also short of breath at sometimes?
Yeah, sometimes.
Okay. Have you had a cough?
Yeah.
Have you been coughing anything up?
No.
Good. All right. Any wheezing in your chest? Any tightness in your chest?
Not really. No.
Okay. Have you had any chest pain?
No.
Have you felt like your heart has been beating irregular, like you've had any palpitations?
No, not really.
you ever feel like your heart is racing, like it's going really, really fast, but you're not doing anything?
Not really.
Okay. And in terms of the swelling in your legs, have you had any swelling in the other extremities, in your arms or anything like that?
No, not that I know of. No.
Okay. And it's really just worse during the daytime, but it doesn't really go away at night either.
No.
Okay. All right. So I checked your vital signs. Your afebrile temperature 37. Your respirations were 18. Your heart rate was 79. Your blood pressure was 149/88. That's probably a little bit higher than it was last time you were in here. Your oxygen stat's a little low at 94%. All right. Her general appearance, she's normally, she's alert, oriented, well dressed for the weather. She's been in a very pleasant mood today. Thank you. Can you tell me where you are right now?
I'm at Research Medical Center.
Excellent. And what's today's date?
Today is Friday, October 13th.
And what's your name?
Angelica Messina.
Very good. All right. I'm going to take a quick listen to your heart and your lungs. I just want you to take slow, deep breaths. Continue to take slow deep breaths. I'm just going to keep listening to your lungs. Lungs are clear to auscultation in the upper lobes. By basilar, she has a little bit of crackles. All right, we'll listen to your heart. There's a little bit of a gallop, but otherwise S1 and S2 is audible. I'm going to listen to your carotids. Just listen for any type of Barré or abnormal sounds. So I'm going to listen. I just need you to hold your breath, okay? And let it out. I'll listen on the other side. Hold your breath. Okay, no Barré noted. Right. Oh, listen to your abdomen real quick. Positive vowel sounds in all quadrants after listening to each quadrant for 1 minute. All right. Would like to kind of check your thyroid real quick if you'll stand up and turn away from me. All right. So pull the skin back. And can you swallow for me? Swallow. Swallow. Okay. You can go ahead and lay down for me, please. No enlargement of the thyroid noted at this time. Just going to feel our abdomen at this time. Check for any enlargement of the liver. Palpate another rib. And the liver is just slightly palpable below the lip of the thoracic cage. And I'm going to check swelling in her legs. She'll start with her pulses. She does have 2 pulses. There is pitting edema bilaterally on both legs up to about mid-calf. There's no erythema or redness on the skin. Skin is warm and dry and intact throughout. My differential diagnosis are heart failure, liver failure, and renal failure. Thank you. That completes this cardiac